Will I have regular blood tests and checkups?
Yeah, so when you're a home hemo patient, you do one set of monthly bloods. The hospital can keep a check on how things are going, how effective the treatment is. If there's any issue with your bloods, they will contact you to let you know if there needs to be a change in medication or your dialysis prescription. So it's all very carefully monitored, yeah.
Yes, you'll usually have blood tests every month, or more frequently if needed. The home hemodialysis team are always there to help. The team, including the doctors, nurses, pharmacists and other health professionals, meet regularly to discuss home hemodialysis patients and the blood results to make sure that you're well.